Welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I'm Angela Yarborough, and this is Dr. Jerry Yarborough.
Hey.
Today we're going to talk about plantar fasciitis, and it affects over 1 million people a year. And recently, I will be counted in that 1 million. I've never had that before until a couple of weeks ago. And we were at our camper, and I knelt down for too long and put strain on my left foot. And it has been hurting me ever since. And it hurts.
Yeah, and so as we talked about, an acute injury, has to be addressed immediately, because plantar fasciitis most of the time is caused from multiple micro traumas to the plantar fascia. And it gets some scar tissue built up, it gets some inflammation built up. It can cause a lot of pain. Remember during COVID, beginning of COVID, I got it climbing up the hill. And it can really, really affect your ability to walk. It is very painful. Some common symptoms is like first thing in the morning you try to get up, out of bed, and you put your feet and your weight on your body, and it's excruciating pain. You're hobbling around like, oh my gosh, what has happened to me? It's severely painful. So, like you said, 1 million people are affected by this. And what the plantar fascia is it comes from the heel, and it goes down the bottom of your foot up to the ball of your foot. And it's just a connective tissue that helps support the arches of your feet and just all the contents in there too. It helps support that. So when we walk and we put weight on it, it just stretches it out. And with a micro trauma, I already said about that, but something else that your body can try to help compensate is it'll try to help get extra support on the heel, and that causes a heel spur actually to develop, okay? And then something else that kind of contributes to plantar fasciitis is as we get older, the fat pad up under our heel degenerates, just like so many other things in our body. So we have less cushioning, we have connective tissue that's got micro trauma multiple times. You get that scar tissue, you get a lot of tightness, you get inflammation, and all of that causes pain. So it can affect so many people. Today we have Skylar joining us. She's a student intern from Louisiana Tech's kinesiology program, and thank you so much for being our subject today. And so Skylar is going to help demonstrate the exercises and activities that you need to do to help overcome the symptoms that you're having from plantar fasciitis, as we talked about in the previous segment. So first we're going to start off with a calf stretch. Again, you're going to find something of 3 to 5 inches to place your forefoot on, your heels on the floor, and then you shift your hips forward, creating a nice gentle stretch, not painful, just a gentle stretch. And you're going to feel that kind of on the bottom of your foot, up your calf, and maybe even up your leg even further. You're going to hold that for 30 seconds, and you're going to do that 3 times, okay? And then you're going to do a plantar fascia stretch. Now here we have this foot roll that we have available at our clinics. You can use at home. I really like to recommend that you use like a 20-ounce Coke bottle, fill it with water so it's cold. You get the coldness, helping also decrease the inflammation and pain that you're having while you're stretching out your plantar fascia by rolling your foot on it. Now you do want to apply enough pressure that you're feeling some stretch, but not so much that it's causing you pain. All right, a third activity that you can do, using a towel on a slicker surface like we got here, you're going to scrunch or crunch that towel up. That is causing the muscles, the intrinsic muscles of your foot to work and to help support the bottom of your foot, okay? You can do that about 10 times. The foot roll you can do, for about 5 minutes, and the stretches you're going to do 3 times for 30 seconds. Now something else that we offer here at Fyzical is we have a a FootMax dynamic analysis of your gait. So you walk over this force plate, and it assesses your abnormalities and your appropriateness for a foot orthotic, a custom foot orthotic. Now, people with plantar fasciitis very commonly benefit from having a custom foot orthotic. This will slip inside any regular shoe, and you can move it from shoe to shoe. So these are very helpful with plantar fasciitis and other abnormalities of your foot. All right, guys, so I hope that helped you. I'll give you some ideas on what to do today for plantar fasciitis, and we'll see you next week.